The time is now. Our children need to be on the forefront of all policies. With every new technology that we bring into our lives, we need to be asking the question, how will it affect our children? How will it affect the environment? And how will it affect future generations? Like many people here, I am contacted by citizens, doctors, people from all over the nation and internationally who want to know if cell phones are harmful. A cell tower is going up at a nearby school. Is this safe? Should we be concerned about the Wi-Fi tablets being brought into schools? People want information. And yet when we go to the CDC website, it states, if you are worried about cell phone radiation, and they give 2 quick tips, that is in sharp contrast to the 20 countries that have issued clear recommendations to reduce exposure, especially to children. And they don't give just 2 tips. Some countries give 2 entire pages explaining how to reduce exposure and how to eliminate exposure by using wired, safe, non-radiating connections. As Ellie Marks mentioned, in 2014, the CDC did recommend caution, stating, along with many organizations worldwide, we recommend caution in cell phone use. This was removed within weeks. The CDC also had a paragraph on children. I'm going to read a phrase of what they stated. If radio frequency does cause health problems, kids who use cell phones may have a higher chance of developing health problems in the future. This text, too, was removed. In fact, the entire paragraph about children's greater vulnerability was entirely removed. In fact, the emails state that an official stated something to the effect of, this would be hard for people to understand. Now, the FDA states on a page that most people won't read or understand, there is consensus that research is warranted to address gaps in knowledge, such as effects on cell phone use over the long term and on pediatric populations. The long term is about cumulative exposure, the daily exposure we're exposed to, and pediatric populations are children. Yet when you look at that page, no one would even get to that phrase, buried. And if you go to the FDA page entitled Children and Cell Phones, it states that the scientific evidence does not show a danger. No mention is made of children's vulnerability, and in fact, it sort of says, it goes out of its way to say, well, adults and children can minimize exposure with these 2 tips that we've provided. I know that I did not sign up for my children to be part of this massive, grand experiment that we have going on. I did not give my consent. The National Toxicology Program is the largest, most expensive animal study done on radio frequency at our nation's top research institution. As discussed, the findings they released about increased cancers, 2 types of cancers that we also see in human cell phone users. The NTP also found DNA damage. And I'd like to quote from the abstract that the researchers just did a presentation. Let me quote them. Exposure to radio frequency radiation has the potential to induce measurable DNA damage under certain exposure conditions. In 1994, 20 years ago, Doctors Lai and Singh found cell phone radiation could damage DNA in their studies. And Motorola wrote a memo to their media advisors on the clear strategy that remains alive and well today. I think that we have sufficiently war-gamed the Lai-Singh issue. Make no mistake, the National Toxicology Program findings have been war-gamed, just as have decades of research. I'm going to read what Crown Castle, that's one of the companies who's putting up small cell 5G mini cell towers throughout the United States, states to their shareholders. If radio frequency emissions from wireless handsets or equipment on our wireless infrastructure are demonstrated to cause negative health effects, potential future claims could adversely affect our operations, costs, or revenues. And in fact, all cell phone companies and wireless companies have similar statements about risk to their shareholders. My question is, why aren't the American people being warned? When we go to purchase a device, we should be told exactly what the companies are telling their stockholders in their annual reports, and who will be liable. I first became involved in this issue in 2012 when I started reading the peer-reviewed research and found that animals exposed to perfectly legal levels of cell phone radiation, and some studies exposed them to just 1 hour a day for 1 month, resulted in brain damage. The radio frequency exposed rats had more dead brain cells and damaged brain cells. Because the first thing I thought about was our children and how they are more vulnerable and their brains are developing. There's also research showing that when children are exposed to the heavy metal lead, which we know is a neurotoxin, causes brain damage, when in combination with cell phone radiation, they have higher ADHD symptoms. Now, in my town of Prince George's County, we have a serious problem of lead in the water, a situation that has been neglected for years, as in many, many school districts. What will it mean for these children who are drinking lead-contaminated water with wireless transmitters every day in their classrooms? There are a lot of environmental justice issues because people in under-resourced communities who are already more exposed to toxic chemicals now will have yet another exposure that will increase the effects. And there's a lot of research showing a synergistic effect. And what of our workers? People who work in retail, coffee shops, delivery trucks, who have no choice in the matter. We cannot ignore this evidence of harm. We can't go back in time with our children. There are no do-overs. Yet most parents are unaware that cell phones emit radiation, much less that baby monitors, wireless gaming, video gaming devices, tablets, speakers, iPod touches, laptops are also sources of radiation to their children. I just wanted to show you something. This is not a Photoshop picture. These are scientific images of wireless radiation from a laptop by engineers Claudio Fernandez and colleagues who are using state-of-the-art equipment to model this radiation as it is coming out of wireless devices such as laptops and also cell phones. Most people aren't aware that their devices emit radiation, nor that this radiation is penetrating into our body. In addition to the American Academy of Pediatrics, there are many medical organizations which have issued recommendations to reduce exposure, including the Athens Medical Association, the Vienna Medical Association. Schools and counties, governments recommend wired, not wireless, in the classroom. Yet in the United States, we are dumping billions into wireless devices as if it can somehow fix the long-standing educational issues which we've had for decades: under-resourced teachers, overcrowding, dilapidated buildings, no air conditioning, and yet we are giving them wireless devices as if it's going to fix these ingrained issues. People often tell me that Wi-Fi is everywhere, as if that is a reason not to act. Yes, Wi-Fi is everywhere. It's in hospitals, rec centers, grocery stores. And I remember when smoking was everywhere and when people not wearing seatbelts were also everywhere. Maryland is the first state with expert recommendations to reduce radio frequency radiation from Wi-Fi in schools to children. The Maryland State Children's Environmental Health and Protection Advisory Council recommended that the Maryland State Department of Education should recommend that local school systems consider using wired devices so that Wi-Fi can be turned off. And instead, a wired local network can provide a reliable and secure form of networking, and I'm going to quote, without any microwave electromagnetic field exposure. They also recommend the Department of Health inform the public about this issue. I'm really looking forward to more on this. The Council's health experts include governor-appointed pediatricians, toxicologists, House and state appointees, and representatives from the Department of Education. When you start speaking truth to power, there will be attacks on the facts you present, on your character, and on the integrity of the science, no matter how credible it may be. And it may feel overwhelming at times. Don't feel, I'm going to quote Jane Goodall, don't feel that because you do not have enough money, power, or influence, that there is nothing you can do. It is going to take a critical mass, and we are making the difference. Now is the time to be involved in the political process, and we need to call for accountability and transparency. We need to invest in our children's healthy future to ensure that they are protected for a lifetime. Thank you.